How COVID-19 impacts on the NHS is a key determinant of how we respond next to the outbreak. There are various figures from different parts of the NHS that help us understand the trends and where we are in the pandemic. Some data are publicly available. Data on hospital deaths show that these peaked on the 8th of April. And routine surveillance data from the Royal College of GPs show us that there's not much transmission in the community.
It is now very clear that the date of death peaked on 8th of April and peaked slightly earlier, about the 4th of April in London. That means if you work backwards, the exposure, the infection came before that date. And on average, that was about 3 weeks before the peak of the death. And that week correlates exactly with the RCGP surveillance data when it started to plummet. And about half of all the infections disappeared in the week before we had lockdown. And that had the most effect in terms of reducing transmission. The encouragement of social distancing and hand washing had the major effect.
These data can be read alongside government figures showing the number of people in hospital with COVID-19. These show that the number of patients in London is coming down. Scotland has been stable for some time, and other parts of the country have started to stabilise too. Other data sets would help us understand what's going on with transmission too. Newsnight has seen hospital admissions data that the NHS doesn't usually publish. Figures show that since April the 8th, hospital admissions due to COVID-19 has fallen from 524 per day to 273. The decline varies in different parts of the country.
Speaking to hospital chief executives and looking at some of the data they've been able to share with us, we can see that, in fact, hospital admissions of confirmed coronavirus cases have been reducing for some time now, for between 2 and 3 weeks across the country as a whole. Of course, there will be exceptions. We can also see from some data that we've looked at from NHS 111, the online or telephone service, which people are particularly encouraged to call if they think they have coronavirus. That information shows a reduction in the number of cases each day quite rapidly over the last, since the beginning of April, of the number of cases which NHS 111, having spoken to the person, thinks they are quite likely to have coronavirus.
People in local authorities have told Newsnight that they're still concerned about transmission in care homes. Some have pointed to NHS policy that has encouraged hospitals to discharge patients with COVID-19 to care homes if they were no longer suffering from acute symptoms. This, they say, may have helped to seed the virus amongst the most vulnerable. Others point to the lack of testing of staff and say that even now, people have to travel a long way to be tested.